And thank you for joining us today. This is the Ask Dr. Tommy Show. I'm Dr. Tommy McElroy, and today I have the pleasure of having in the office Dr. Anahita Azharian of Magnolia Plastic Surgery Center, and she's going to educate us about plastic surgery, and in particular plastic surgery, how it relates to women and when their bodies change either through pregnancy or weight loss or things like that. Dr. Azharian, how are you doing today?
Good. Thank you for having me.
Thank you for coming in. And I also have the pleasure of having a special guest host, Tracy Hoyle, who is our clinic coordinator. Tracy, how are you doing?
Fine, thank you for having me.
Good. Go ahead and start. You had a question for our doctor.
Yes, I do. First thing I wanted to ask is about, I had a patient ask about keloids.
Right.
Is there anything they can do to, not have their skin get keloids? Is there anything they can do?
Sometimes pre-treating the area helps. If they are prone to keloiding, they need to let their practitioner know ahead of time, and sometimes applying pressure dressings like silicone pressure dressings, it does help. But at the end of it, if there's somebody that keloids, their chances are they're most likely going to have it. It's just to what degree it will be.
What is a keloid?
Keloid is basically overactive scar tissue when they're healing from an area that's been traumatized, whether it's pierced ears or a mole that was removed, and certain ethnicities are more prone to it than others.
So I think it's like you said, people with darker pigmented skin.
Blacks and Asians are more prone to keloiding. Doesn't mean that whites wouldn't, but technically those individuals are more prone.
What about like Mediterranean?
Usually not.
Skin.
I mean, nobody's exempt from it, but usually not. Usually the patients we warn about ahead of time if they're going to have a surgical procedure is Asian and blacks.
And you can revise a keloid, but sometimes it's not necessarily a very effective thing to do.
Right, because you're basically cutting through again and you heal with scarring. So basically you cut out scar tissue and then you heal with more scarring. But sometimes we pre-treat it with substances like Kenalog to help.
You know, and that's one of the things that we do as family doctors. You know, we know enough to inject keloids sometimes.
Exactly.
If a keloid, this person's a keloid former, let's say, and you want to try to arrest that, when is the time to inject the keloid?
Initially at the beginning of it,
okay, so
you just start injecting. Sometimes we do it in the operating room, especially if we do remove it. We just inject some Keloid in there and close. I mean, it could affect the wound healing, but for their purposes, you don't want that extra growth there.
Okay. And you had another question, Tracy, about the weight loss and surgery, and when do you do you do the surgery after you've had weight loss, close to your ideal body weight?
Right. Do you have to, let's say a person's lost 50 pounds and they feel that they're at their ideal body weight, but maybe you think they're not. They have 20 more pounds to lose. Do they have to lose that 20 pounds, or can they go ahead and come in for maybe a tummy tuck or liposuction?
It all depends on what their weight is at that point. If they're still 200 something pounds, even after a 50-pound weight loss, we encourage them to lose more weight. If they absolutely think they can't get to their ideal body weight, then that's something to discuss. They just have to be realistic about what their results are going to be. But usually we encourage them to get to that ideal body weight, both for the purposes of getting the better result and also maintaining it afterwards.
And when you say ideal body weight, what is that?
It's different for every individual depending on their height, and also some people are never going to reach that BMI of 24. Sometimes BMIs are not exactly real, depending, sometimes your height takes away from it.
Right. There was a question we had earlier about tummy tucks. What is a tummy tuck, and how is that useful versus liposuction?
Tummy tuck, you remove skin and you tighten the muscles underneath. That can loosen up as a result of pregnancy or weight gain. You have to make sure that you're kind of finished with your childbearing portion of your life, and also you are at your ideal body weight. Liposuction, you just remove the fat under the skin. It's impossible to remove all of the fat, so you are going to have some maintenance to do. If you gain weight, you're going to get some of this back, but it doesn't remove skin, and it doesn't address the muscle laxity.
So if a person has, let's say they're childbearing, 8 years or over, and they have this loose fascia underneath, the rectus is, the linea alba is stretched out, let's say. Then when you do the tummy tuck, you actually go in and you suture it together.
Exactly.
Kind of bring it closer to anatomic where it was before.
Exactly.
Is it incision from hip to hip or a bikini line?
We put it at the bikini line, but it does go hip to hip. The larger the person is, the more loose skin they have, the longer that incision is going to be. If they're more petite, we usually kind of stays within the hip to hip. But usually we put it at a area that with their underwear or bikini, whatever the style is for now, it will be covered and it's not obvious.
This is the Ask Dr. Tommy Show. We're in the office here with Dr. Anahita Azharian, who is the owner of Magnolia Plastic Surgery Center in Wesley Chapel, and the website is magnoliapsc.com. And then when we return, we'll talk a little bit more about her background, and then also some of the different things that plastic surgery and cosmetic surgery, what does that mean, or is there different things that you can have done at different ages, no matter what your background is. And this is the Ask Dr. Tommy Show. We'll be right back.
Darn phone.
Yeah. So let's do this. You come back, talk to who you are, this, that, and the other, and then maybe talk about some of the things that you can do for kids, other people,
Kids? What are we doing?
like ears. Do you do ears?
Yeah, pin them back.
Yeah.
Yeah, we just wait till they're older, yeah.
Yeah. Talk about that, because there's parents out there who want their kids.
Yeah.
Whatever.
Oh yeah, have you done that before?
Mm-hmm.
Okay.
So what, like ears that?
They protrude out,
Mm-hmm.
and it kind of makes the kids have to look up.
Yeah, it's like a psychological thing.
Yeah,
It's
like
a psychological thing.
Try to.
Am I not talking close enough?
I just want it to sound good.
You want to play it back for a second
No.
and see? Okay. You sure?
I can.
Then that would be ideal.
Otherwise, we're gonna be like, let's do this next week. It'll never make it on air.
Would you like the help? Then I'm not coming back next Wednesday.
Make sure your mics work.
Okay, let's do it. Actually go in and you suture it together and kind of bring it closer to anatomic where it was before.
Exactly. Is it an incision from hip to hip or a bikini line? We put it at the bikini line. Does it sound all right?
She sounds better.
Yeah. And I was sitting there last time, wasn't I? No, I was
No,
sitting
you were
here.
sitting there.
You turn the mic.
I think I'm closer to this than you are, and I have this.
Yeah.
Oh, she just on the camera.
But that's going to that only. Okay. It sounds okay. Just try to, if you can, lean out a little bit.
Okay.
We don't have the benefit of multiple lines. And thank you for joining us again. This is the Ask Dr. Tommy Show, and I have the privilege of talking to Dr. Anahita Azharian of Magnolia Plastic Surgery Center. Give us some of your background.
Well, I was raised in Tampa area. I moved up to Philadelphia where I received my medical training. My medical school was down in Fort Lauderdale, residency and fellowship up in Philadelphia, and I worked in Manhattan on close to Central Park for a couple of years, and then decided to be closer to family, so I moved back here and decided to open up my own practice in Wesley Chapel.
When did you decide that you want to do plastic surgery?
I think since I went to medical school, it's one of the more diverse fields of surgery. There's a lot of different aspects to plastic surgery that people don't realize usually. So you get to pick and choose what you want after, but you get trained.
There's cosmetic surgery, which most people are familiar with. They think of a plastic surgeon, they think
Exactly.
of facelifts and breast augmentation. But one of the things we're talking about in the break is, children that have maybe protruding ears that
Right.
cause some social concerns.
Psychosocial concerns for the parents. So yeah, we see a lot of pediatrics, whether it's a congenital deformity or something as simple as their ears that are protruding out, and they get picked on at school. Usually we try to encourage any surgical procedures for kids unless it's certain congenital issues that has to be done at certain stages for them to be as have fully developed, like past their teenage years. But sometimes they're so traumatic for them that with the parents' consent, we do the procedures to basically pin the ears back so they're not protruding as much to help them in school and in their social life.
What about for things like skin cancer? Is that something that you specialize in, removing moles?
Absolutely.
In a way that's cosmetically appealing?
Yeah, cosmetically appealing, and also we work with a lot of dermatologists because sometimes the resections are very large and it's not something that they can just close together, and we have to move some tissue around to basically be able to cover things back up, especially if it's on the face.
All right, Tracy, what else do you want to talk about?
Well, we start to talk about boobs.
Okay, let's do that.
Man, we're trying to cover it all.
All right, ready?
Mm-hmm. I have a question about breasts. So when someone comes to see you and they want larger breasts, do they need to get a lift as well, or can they just get...
Can you stop it? I thought I stopped this. Ah, sorry. Sono my bello. Let me put this on vibrate.
Is that your pin down here?
No, that's you guys.
Oh, it's part of ours.
All right.
Oh,
We'll
Sorry.
just start over at the beginning.
Sorry.
okay.
Breast assist.
Breasts. Yes, I have a question about breasts. When someone comes to see you, do they need to, if they want bigger breasts, do they have to do a lift as well, or can they just get larger breasts? And what do you do? Silicone, saline? What are their options?
It all depends on what the anatomy looks like, what they're trying to achieve. There are patients that have a lot of drooping, whether it's from weight loss or breastfeeding or just anatomically, that's how they were built. They're gonna need a lift along with the breast augmentation. There are patients that they think they have drooping, but when they come, we can put in an implant and correct that with just the implant. So it all depends on the degree of it and what they're trying to achieve. As far as the type of implant, there's pros and cons with each. Some patients are a candidate for having silicone. Some patients can get away with having saline. There's a price point difference, and all of those we discuss it with them when they come in for their consultation.
And back to the point of breast, you know, when a woman has had children, generally the breast tissue, do you tell them to wait until, if they're going to plan to have children, if they want to have breast implants, or does it matter?
I mean, breast augmentation is the first or second most common plastic surgery procedure done depending on the year. It always rivals with liposuction. There's plenty of girls in their late teens, early 20s that get breast augmentation. Usually those individuals, they end up having one more surgery at some point in their lifetime. But if somebody comes in and they're in the process of breastfeeding, we tell them to do it. Otherwise, no, not really. They just have to understand that if they gain weight, lose weight, become pregnant again, all of those are just factors in nature that are going to affect things.
Now, I've heard that that maybe they will lose feeling in their nipples. Is that true?
It's possible, or it could get hypersensitive.
Okay.
So those are all
and
discussed
they can
with
still
them.
breastfeed.
Technically, it's in the consents that if you have any kind of breast procedure, we always say that there's a potential for not being able to. But again, there are plenty of women in their early 20s that are not even thinking about having children, are having breast augmentation, and they go on to have successful pregnancies and breastfeed. So, but it's always there that there's always a potential, because we don't know if that individual could have, maybe even if they didn't have a breast augmentation, not been able to breastfeed. So you just want to make sure all the bases are covered.
And we're in the studio here with Magnolia Plastic Surgery Center owner and medical director, Dr. Anahita Azharian. And when we return, we're going to learn about what happens when you have a consultation for plastic surgery and what to expect. This is Ask Dr. Tommy Show. We will be right back. So I'll just...
Anahita is such a cool name.
Thank you.
So what we'll do is I'll just throw it to you and say, how's it go?
Okay.
And then we'll wind it
It's
up.
the Persian goddess of water.
Oh, so you're...
You want to check on our patient, make sure she's okay? Tell her we're almost done.
Yeah.
Actually, though,
You think I'm done?
Yeah, you're done.
Okay.
Okay.
Jesus Christ.
You're fine.
You're
Get
like,
it.
So lossy, isn't
no, she just like twisted the
Oh,
thing.
did
I
I
was
knock you
like,
out?
almost. Well, not really. It wasn't gonna reach, but.
Thank you, Tracy. And this is Dr. Tommy McElroy, the Ask Dr. Tommy Show, and I have the pleasure of talking with Dr. Azharian. And so when a person comes in for a consultation, how does that go with you?
So usually when they come in for a consultation, we get all of their medical history information and go through that, and also find out why they're there. Based on their medical history, if they are a candidate, then we proceed and see what they want to have done. If they're a good candidate for that, discuss different options, go through pros and cons, and at that point then they can they're given a quote as far as their surgical procedure goes, operating room cost, anesthesia, and we kind of
So
leave it up to them. Mhm.
All that's complimentary. I mean,
Yes,
you don't charge for
everything
that.
is complimentary.
That's great.
Yeah.
How long does that take generally? Depends on the subject, I guess.
Depends on the subject, depends on how many questions they have, but usually about half an hour, 40 minutes. We usually let them kind of ask all their questions and get all the information they can get.
As far as some of the more common procedures, what do you do more commonly than others?
Breast augmentation, tummy tucks, those are the two big ones. Liposuction.
What's the recovery like for, I would say, your typical breast augmentation?
Typically, most people go back to work after a week. There's restrictions afterwards, especially depending on what kind of implant they have. But majority of people are back to work within a week. The first few days are tough other than that.
As far as, other types of surgery, if they have a surgery, do you perform that here in the local surgery centers?
Depends on what it is. If it is a cosmetic case, they're done at local surgery centers. They're more cost effective for the patient, and also these surgery centers are used to having cosmetic cases there, so they have great staff that can handle that kind of procedures.
And then if it's more extensive, obviously, then
More extensive, if they're medically not fit to be at a surgical center, or if it's reconstructive cases, they're done at the hospital.
Tell us something. Let's do something personal.
Like
What do
what?
you like to do in your free time? Blah, blah, blah. You want to do that?
Shop.
Okay, that's fine. I'll just start with- What do you like to do in your free time?
Me? Well, just like all the women, I like to shop on my
Yeah.
free time. Sit down, put my legs up because we're standing on our feet all day.
Yeah. You shop
hang
online or
out.
in person? Or both?
Both, but a lot of times online it's just something leisurely to do.
Have you ever heard of Wine and Prime?
No.
That's where you drink wine and they go on Amazon Prime.
Oh, really?
Yeah, one of our colleagues, Robin Hatfield, is famous for ordering
Wine and
stuff
Prime.
after Wine and Prime.
Yeah, no, I try to keep it sober when I do
Yeah.
that. Yeah.
Getting stuff on Amazon is almost like Christmas every day if you're ordering stuff, even if it's something so small as like a book or something.
Yeah,
It's
it always makes you feel good when you get something
Yeah,
in the
it's
mail,
kinda like
something
adult-
waiting for you.
Adult Christmas.
Yeah.
Well, thank you so much for coming in and sharing with us. And if people
Of
want to
course.
learn more about you, we'll go to magnoliapsc.com. And like you said, if they want to have a consultation, it's
Consultations are complimentary. Yeah, all they have to do is just call our office and set up an appointment.
yeah. And I think if you're in the area and you're Wesley Chapel, North Tampa, even Tampa, Zephyr Hills, definitely it would benefit you if you're in need to have some education to talk to Dr. Azharian. And thank you so much for coming in.
Thank you for having me.
And until next time, for all of you out there, if you want to hear more of the Ask Dr. Tommy show, go to AskDrTommy.com, and you can listen on iTunes as well. And until next time, bye-bye. It was right at about 15 minutes.